All right, our next speaker is wonderful. It's Dr. Amanika Kumar. She has done a lot of research in ovarian cancer outcomes and quality of life with endometrial cancer. She's one of our gyne oncologists at Mayo Clinic, Rochester. Today she will talk on non-surgical approaches to endometrial cancer.
All right, great. Thank you guys so much. So today I am here as a GYN oncologist. I'm based out of the Rochester campus, and I'm going to talk about the obese endometrial cancer. And I was listening to the other talks this morning and looking at the titles of talks coming up. Dr. Kapoor is going to talk about weight gain. And so obesity obviously is coming up over and over and over. Dr. Chen talked about it as a risk factor. And so we're going to talk about it as how do we care for these patients who are obese with endometrial cancer, because that's really the majority of our patients. I don't have any conflicts, but I will be talking about the off-label use of progesterones in the setting of cancer and hyperplasia. Before I start, I just want to say thank you to the group of people in my division and in our department over in Rochester who's really worked together in a concerted effort for us to really change the culture of how we treat patients who are obese with endometrial cancer. And I'll tell the story a little bit of what we've done in our own division and talk about opportunities that we have really in every one of our primary care offices, our OBGYN offices, and really nationally on how we change the conversation. We've had an incredible group of people who have all really worked on this. I'll just point out that both Megan Bird and Megan Weinhold have taken this on as a project. I'm just one of the partners in this, and we worked very closely with our endocrine colleagues as well. So we're going to talk about the relationship between obesity and endometrial cancer, talk about alternatives to surgery for some of these patients. We're talk about recommendations regarding weight loss in endometrial cancer patients, and then talk about the work we've done in Rochester. So everyone knows this. It's the fourth most common cancer in women in the U.S. It's a very common gynecologic cancer. But I think what we sometimes forget is that there are over 800,000 living survivors in the U.S. with endometrial cancer right now. And those are patients that we're all seeing. And yet we hear a lot about breast cancer survivors, and there's a lot of word on the street about their needs, their quality of life issues, and there's not nearly as much about endometrial cancer. And that's our fault. We've done that. And we have a real opportunity to help this group of patients that are living in our community, seeing us in medical care. There's two types of endometrial cancer. We're going to completely focus on type 1 cancers. These are the low-risk, low-grade cancers that are obesity-driven, that are